Anatomy and physiology instructors at Florida Gateway College held a symposium November 30th to discuss influenza and what you can do to prevent it. This program is 50 minutes long.
Well, welcome to you. We're glad you're here today. And how many of you are going into the medical field? I'm just curious. Oh, wow, many of you. So a symposium like this is very valuable for you because you know that many of the people that you will be caring for in your profession will be experiencing some of these things, but also it's just good to know from a community standpoint, how we handle these things. Well, I want to start it off by saying thank you to you for coming. It shows your interest and your willingness to learn, and we're excited that you're going to be taking care of us. We're going to treat you really well because one day I realize I may be in a nursing home and you may be the person giving me my care. So I'm going to be really nice to you, all of you. I want to introduce, many of you know, and maybe some of you don't, but we have 4 eminently qualified professionals here to talk to you today about the subject. 3 of them have medical doctorates. So Dr. Guzman, Dr. Lumbo, and Dr. Pardo. So they were all medical doctors, 1 in Venezuela, 2 in Colombia, prior to coming here. And so we're very grateful. Not many colleges have that kind of experience teaching their anatomy and physiology classes, as you can imagine. And that's one of the reasons that we're one of only 2 Florida colleges with a cadaver lab. Mostly that's housed at the university level, so we're very grateful for the experience that many of you are getting here. And then Dr. Boyce has a PhD in microbiology. Go try that one at your local place of learning. That's not easy to do, I promise you. And so we're very thankful that she's here to share with you too. And there's a special day. So Dr. Lumbo, she doesn't want me to say this, but it's her birthday today. So you make sure to wish her, well, let's do it on 1, 2, 3, we'll wish her happy birthday. Ready? 1, 2, 3. Happy birthday! All right.
And as you already know, I'm Doris Lumbo, an anatomy and physiology professor here at Florida Gateway College, and a proud professor to be over here, as well as thank you for being here today. And the mission of our educational institution, it is to keep our community informed. That's why we were interested in presenting today the flu. We're going to talk about the flu and the importance of the flu vaccine. Just Dr. Dobson already introduced everybody. Then I'm going to summarize what we're going to cover today. We're going to talk about the epidemic and pathogenic of the flu, as well as the symptoms and complications, diagnosis and the virus, the vaccine, and the treatment. That's a summary of what we are going to cover. Now, when we decided to talk about the flu, just if you Google it or if you start reading about the flu, you're going to see that it is the 2nd most common infection. And I remember that I was criticized in order to use this photograph over here because it is not a nice figure. As you already know me, I'm not the one that plays nice pictures at times just because we have to deal with diseases, and this is not something to be pleased or smiling about at times. This is an old gymnasium that was converted into a hospital temporary because of a pandemic. In the 1900s, at the beginning of the 1900s, the flu pandemic caused them to have this amount of people in a hospital, just temporary. That's why we are going to describe what is an epidemic. It is the fast spread of an infectious disease to a lot of people in a short period of time, like less than 2 weeks in one location. That's what is an epidemic. We all know what means an epidemic because we have heard about these type of things like other type of infectious disease. What's the difference with a pandemic? It is the fact that it moves out through other countries. It will be spread worldwide. That's the difference between an epidemic and a pandemic. Also, when I started reading about this, it was described as history that after a short break, an educational institution, the group of students came back to class, and 1/3 of them died because of the flu. Then at times it is scary, but we have to be aware. And one of the things it is affect 36,000 deaths per year in the United States, the flu. That's an average number, 36,000 per year. Also, it increases the hospitalization rates by 200,000 hospitalization a year in the United States coming from the flu. Then we need to be aware, and we have to take measurements in order to have the vaccines used and prevent these type of problems, because it is as easy as it sounds. Now, the definition of the flu, it is a highly contagious, seasonal generalized disease. What means that is seasonal? We always see the flu through the winter time, and it will be different depending on the northern or southern hemisphere. Then we will have different season time, and it is used to the winter time. What happens, as you all have experienced, during winter we have the tendency to be more inside and close together. That makes this spread easily than over the summertime that everybody is outside, fortunately. Then that makes the difference. Also, it's gonna affect the respiratory and digestive systems. That's how we see the symptoms coming from the respiratory system. And the virus, the flu virus, it is type A and B that compromises the organs and at times could give you symptoms from the central nervous system. Just occasionally, you can have those type of things. Because we are close to final exams, this PowerPoint cannot be an exception over here. Multiple choice question, the right answer it is A and B. Those are the type of viruses that are gonna cause flu. Type A, H1N1, and H3N2, and Dr. Boyce is gonna describe them because she is the expert on those type of friends. And B, it is the Victoria and Yamagata. Those are the two types of virus that are gonna cause human influenza. The other two are gonna have mild respiratory problems, and the type D is gonna affect animals more than humans. How the flu is gonna be spread? The flu is gonna be spread through the air. Basically, when we talk, 6 feet apart can be spread that easily. Also, when you sneeze or cough, that's gonna cause the spread of the virus. One thing that we don't even realize is that you can touch an object or surface that it is contaminated with the virus. And often, right immediately, we touch our nose or mouth. That's something that we do unconsciously. Then we have to be aware of those type of things. Don't do it because that could be happening. And that's the way that most often it will be spread easily through the air. How contagious it is, the flu? It is a highly contagious disease. And what happens it is, one day before you become symptomatic, in other words, you're not even aware that you are sick, you start spreading the flu virus. Then that's the first thing. And after you are cured from the symptoms, 1 week after you're cured from the symptoms, then you're gonna spread the flu virus 1 week after that, and it could be longer, up to 2 weeks in children. Then that's one of the higher risks of spreading the disease and make it a highly contagious. Then, let's see, one day you probably woke up and saw yourself in a mirror like this. Probably you felt that way. Not a pleasant sensation. Now, Dr. Pardo is going to continue.
This is me last week. No, not exactly bad. I had one kidney stone last week, and really, it's not miserable that this main, but it's a little same. Okay, I am going to talk about the signs and symptoms in this flu. We can find different types of symptoms in this infection. This is a viral infection in our respiratory system. We found fever because it's infection, chills, sometimes cough, sometimes sore throat, but the more important is fever, headaches, fatigue, and muscle pain or body ache. This is very important that everyone remember about the symptoms in this viral infection in our upper respiratory system. This is why it's very important to remember this slide, because during our life, everyone, during many years, everyone, we have many different types of colds, yes? But flu are a little different, or flu or influenza is another thing. It's really is a more important viral infection. Because cold, we have sometimes chill, fever, but it's not frequently. For example, in influenza, fever is frequently. It's rare in cold. Or the fatigue is frequently in our influenza or in these flu problems, but it's not frequently in cold. But in cold, it's frequently, for example, sneezing or stuffy nose. This is why it's important to know one important comparison between these two infections. The different complications that we found is depending what is the situation. If we go very quickly to the medical doctor in emergency room, really sometimes it's everyone wait until, this is for example what happened with me last Monday. Really, I am not the perfect patient, yes? I am person too. I am medical doctor, but I am person too. Okay, I waiting for the pain. Okay, this is my bad. I say to my wife, this is my bad. This is not the kidney stone. She say, it's a kidney stone. Okay, I remember, yes? But this is the same for many people during our life, yes? We wait until what? Yes, we need to go. We need to control our body. This is what I say all the time to my students. Really is very important. And the complication, for example, is a one infection in our upper respiratory systems. This infection can migrate to the lower respiratory system, to our lungs, yes, to our bronchus tree, yes, and produce this problem, big problem, the name pneumonia. In kids, yes, in kids, it's very frequent complications that I said in Anatomy 2 for all my students, that everyone remember that exists one perfect communication between our throat and our middle ear, the name pharyngotympanic tube. This connection is a one connection that facilitates that these infections go to the ear, the middle ear, and produce one normal infection, the name otitis media, that is crazy in kids. Or another situation, in our sinus, maxillary sinus, frontal sinus, we have inflammation, infection, the name sinusitis. Another complication, heart disease, infection in our membranes, the name pericardium membranes, the name pericarditis frequently, or asthma disease. This is why who has higher risk to acquire this infection, this viral infection. All the people that has respiratory problems, yes, previously or before asthma disease or bronchitis or another respiratory problems, or cardiovascular problems, heart disease, all peoples, pregnant women, or people with has low defense about our immune systems. When we have problems about our immune systems, cancer disease or HIV disease, immediately this facilitates the contamination in all people. This is about symptoms and complications.
Now, the first thing about the influenza virus is it's a negative stranded RNA virus, which, okay, you guys are all looking at me like, what? But it's enveloped, and those 8 segments are separate strands of RNA. And so when we get into the shift and drift that occurs, you're going to see where that affects it. It has an envelope. It gains that envelope from the human. It gains the envelope from the human. It's helical. We've got our types A, B, C, and D. As you learn, D is mostly with the cattle. C is local infections. A and B we have to worry about with epidemics and pandemics, as we're talking about. Transmission, inhalation, fomites, yeah, that grocery shopping cart handle, the doors walking into the grocery store. The viral strains, what they have is they have spikes. These are hemagglutinin protein and neuraminidase proteins. That is what's changing during the shifts and drifts and makes people susceptible. Now, how long was it that you contracted the virus before you actually had the symptoms? About a week, 1 to 4 days, depending on your immune system as it stands. So with shifts and drifts, what happens is those spikes, we get changes in the protein due to the changes in the genes for hemagglutinin and neuraminidase. So if you look at a drift, we get influenza 1 entering, those 8 segments are down. We replicate those 8 segments, and then it's sent back up into the virus. Now, it gained that envelope from our host cells, so we aren't going to know it as foreign. We aren't going to attack it, and it's slightly different during that mutation process. So we end up with a slightly different virus. So we get those periods of every couple of years of having a more severe flu season. With a drift, it's slightly different. With the shift, you just had those slight differences, so we just see a little increase here and there. With the shift, you get the viruses, 2 viruses attaching at the same time. Hemagglutinin allows it to attach. Those neuraminidase spikes allow it to enter the cell. And up on that entry with the neuraminidase, both of those cells, we get a mixture of that RNA that we then replicate. Now, as we're replicating that, the genes in the antigen from 2 different viral types, so let's say we're talking about H3N5. Oh, well, where did H1N1 go? What's H3N5? What is H8N9? This is when we get a combination of a human and animal. So all of a sudden, influenza, H1N1. We've got the bird flu and the human flu, both inside this person. The new virus coming out is going to be completely different from those 2 because it's going to be a combination of those 2. When we're talking about influenza D, that is also in different animals besides cattle. Dogs, for instance, get influenza D. So with those slight changes that occur in the different animals, Of course, now all of a sudden, it becomes human. So right now, in those A, B, C, D types, that's all due to the protein code and the differences in the proteins that we're looking at. And so when we actually test for it, that's what we're doing. We're looking at those proteins. Now, I don't know how many of you know this, but there is a rapid influenza test. It's not very accurate. We can test for antibodies or antigens. Once that diagnosis comes back, it's just a quick, rapid test, ELISA. We can then look at the viral culture tissue and look at the cells, and we can actually see if we got type A and B. We can look at the nucleoprotein, which one of our rapid tests does, and we can detect both A and B, which we'll get into in a minute. The immunofluorescence, direct versus antigen, and indirect versus antibody testing. Rapid molecular assay, where we can actually look at the differences in the proteins. And our reverse transcriptase PCR, we're just amplifying the DNA and then running other molecular tests on it for that nucleic acid. So with the basic testing we do at the point of service, you've got, if it's positive for one, interpretation, you cannot exclude false positives. You cannot exclude false negatives. So there must be other diagnostic tests. You might look at the symptomology. What symptoms and signs does the person have? Are they running a fever? Do they have the headache, which is a symptom, versus the fever, which is a sign? Then we want to do additional testing. We want to look at that molecular assay. We want to see those differences, because those differences is what leads us to an epidemic. How do we do that? And that's when Dr. Guzman will come in and talk about those differences. Because we actually look at, and they have 9 different labs that actually look at those molecular assays and determine what season and what flu viruses we're going to be seeing that season, and that's what goes into the vaccines. A negative interpretation doesn't exclude it either. You've got your negative, but you want to look at those clinical signs and symptoms and consider additional testing.
After hearing all this important information from Dr. Pardo, Lombo, and Dr. Boyce, I know that some of you are not familiar with the terminology we talked today about. So let me tell you, let me begin this explanation just saying to you that we have two important classifications of the viruses. The first one is RNA, that corresponds to this group of viruses we're going to talk about, and the second one is DNA. But when we are talking about DNA and RNA, I'm not talking, I'm sorry, no offense, I'm not talking in Chinese. I'm talking about the acids that are and compose the interior of the nucleus of the cells that help these two groups of viruses to penetrate and to enter and also to duplicate inside of the human body or the animal body in general sense. Well, that's the first thing I wanted to clarify, and in order to facilitate my explanation. And the second one is that Dr. Boyce was talking about some groups of viruses, and the first one H and the other one N. So hemagglutinin and neuraminidase. So what is that? In simple words, those are little particles who are attached to the surface of the viruses. And the first one, hemagglutinin, allows the virus to be attached to the surface. And the second one, neuraminidase, is the one that will allow the virus to penetrate inside of the cell, duplicate inside of the cell, and spread the infection all over the human body or the animal body. Well, so the first thing I need you to know is that every single person that provides health, that is submitted to the human contact, must be vaccinated. with few exceptions. And I will be talking about the few exceptions a little bit later. I need to know from you who is vaccinated already. Uh-oh, I have some vaccines right here, so the ones who are not.
In my pocket?
In my pocket, in my left pocket. All right.
That's a good idea.
Reason why? Well, the three doctors who talked before me just mentioned to you that sometimes we are transmitters and we don't feel like being affected by the infection. So we need to be protected and we need to prevent the infection from being spread. Well, if I'm talking about prevention, I know that most of you, if not all, are involved in health. I mean, sooner or later, you will become nurses, medical doctors, or you will enter into any branch of medicine. So you need to know this. The most important thing, and this is what I need you to remember forever and ever, the most important thing, my friends, is to prevent. Whenever we don't prevent, we are failing as providers of health. That's simple. Don't even think that I'm saying a lie. We are failing as providers of health. So that's why this is the most important portion of this presentation, and the following presentations we'll be working with in the close future. Well, and let me begin with the timing of vaccination. When do we need to be vaccinated? So remember that we have a peak. We have a peak of presentation of every single one of the diseases, I mean the seasonal diseases, and the flu is a seasonal disease. Well, remember, by the beginning, maximum by the end of October is the ideal place for us to receive the vaccine. Reason why? Well, we have an expert here, Dr. Boyce, and I'm sure that she will agree with me. Well, the immune system needs a period of time that ranges in between 15 to 20 days for fully activate the immune system. Hey kids, that's why, and I will be talking about that a little bit later, that's why sometimes some people say, hey, I received the vaccine and I got sick. Uh-oh, big mistake. That vaccine has no alive viruses. So it's impossible for the vaccine to transmit the disease. You already have it inside. Well, look at this. Children in between 6 months through 8 years will require 2 doses, receiving the first dose as soon as possible and the second dose more or less 4 weeks later. It doesn't matter if it's delayed a little bit or it's a little bit sooner than normal. Well, and my friends, you need to know that vaccination should continue to be offered as long as influenza viruses are circulating, and the most important thing, the unexpired vaccine is available. So the ones who have not received the vaccine yet, you are on time. So the peak of the disease will be by the end of December, beginning of January. So you are still on time. So you still have the 15 days for you to allow your immune system to improve your defenses. Something you need to know. Hey, but you were talking about little children over 6 months of age. But what can we do with the ones who are 6 months and under? Just take care of them. Be careful with them. So if you suspect that somebody around you has the infection, or you hear that somebody is sneezing, please don't submit them to the risk of getting the flu. Their immune system sometimes is protected by the mother. Remember, the ones who already had the class of Dr. Boyce or the class of Dr. Lombo or Dr. Pardo can remember in the part of immunity that IgG, immunoglobulin G and A, are the ones that easily pass through the milk of the mother and give extra protection. And now the tendency of some mothers is to milk the babies up to the 6 months of age, which is good. Well, may I continue? Well, look at something here. Children at over 6 months must be vaccinated. Why? Because of complications. And remember, I need you to remember this word, quadrivalent. Quadrivalent. What is the meaning of that? I will be talking about quadrivalent. That's why I put this word right here. Quadrivalent means that the actual vaccines are composed by 4 different kinds of strains, two belonging to the type A, and for sure the other 2 belonging to the type B. Initially, years and years ago, they were trivalent. That's why they had a very high rate of failure. Any question with regard to this? Okay. The line of the ones who want to be vaccinated, please go close. I'm sorry, just kidding. All right. There's something very important you need to know. Very important you need to know. All right. There are certain modifications in the season 2016-2017. So I know what you are thinking. In between 2016 and 2017, recommends the utilization of the flu shot, the two varieties, inactivated influenza vaccine, abbreviated as IIV, and the recombinant influenza vaccine, or RIV. What does it mean? What's the difference between one and the other? So the difference is that this one, the first one, let's say is not, let me use simple words, is not created in artificially using different kind of methods, like is the egg protein or ovoalbumin. Well, and what I need you to know, providers of health, is that the nasal spray or flu vaccine, live attenuated influenza vaccine, or LAIV, should not be used during this season. I'm waiting for the question. Thank you. You made my day. All right. The reason why is that the rate of success of this during this season, we don't know what's going to happen during this season 2017-2018. So the reason why is that during this season, the viruses, the strain of viruses that are already mutated, gave a very poor rate of success at under 30% compared to the previous ones that are in between 60 to 70%. My friends, what kind of vaccines do we have in the market? I need you to know the different kind of vaccines, and you have to know, and you have to remember this for your close future. Well, we have three basic ones. The first one, the traditional, is the egg-based flu vaccine. Uh-oh. Who is allergic to egg here? Nobody? Okay. Well, in advance, I want to tell you something. What is the magic question whenever somebody is going to receive the vaccine and tells you, I'm allergic? I had a lot of hives when and the question is, can you eat scrambled eggs? I'm teaching medicine now. So when the patient tells you, no, I love scrambled eggs, and you know, the ones that are still a little bit soft. Hey, he's lying or she's lying. He is so scared about receiving the shot. He is not allergic. All right, kids. The second one is another one that grows in cells, different kind of animals. By the way, we are animals as well. I was talking to that with Dr. Boyce a little bit later. So when we were talking about the type D, I'm sure that, whenever the ones who are dog kissers, please don't do it. And the last one that should be used in the real allergic population, which is the recombinant flu vaccine, is artificially created using most of the times different kind of insects that won't produce that. So there's somebody that is just running because he is afraid about receiving the vaccine. Hey, don't leave. Hey, man, I have the vaccine here. Okay, I got you. Okay. Well, my friends, these are the recommendations. These are the recommendations whenever if the ones interested can copy that. So I will summarize that. So in simple words, whenever you have a real patient that is mentioning to you, yes, I am allergic, and I had a problem that is called angioedema, I mean swelling of the body, seconds to minutes after receiving or being in contact with the ovoalbumin, which is the protein that is inside of the egg, and sometimes helps to produce or to multiply the virus. So you have to be highly careful, and you have to follow this schedule. Well, as I mentioned to you, after eating eggs or egg-containing food, does the patient experience only hives? Only hives? Look what happens. You can give to the patient the shot, hey, my friends, and you won't have any problem. But where is the problem? And you are thinking at this moment, but what happens to that patient? The patient you mentioned before with angioedema, I'm going to the most critical condition. What happens to a patient that almost died whenever he ate last week an egg and he was moved? So the family called 911 and the guys arrived with epinephrine and blah, 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 and had to insert a tube and a respirator and blah, 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 blah. What happens to that guy? Hey, don't give the vaccine, right? Don't even try. But when you have a patient, whenever you have a patient, my friends, who had only hives, some eruption in the skin, that after the administration of an antihistaminic, or why not? Maybe the medical doctor or the nurse was so aggressive and placed a shot of epinephrine. Hey, you can do it, but you can do it. You can apply the vaccine under control. You have to take the patient, not necessarily in a hospital, can be in a medical office, can be right here under your surveillance, and you can apply the vaccine. Is that clear? That's the summary of this very complicated thing. Any question? Any doubt? Are you sure? Can I sleep like a baby tonight? Good, I need it. All right. Let's go to the portion of people who cannot get the flu shot. Well, remember what I mentioned to you before. We have different kind of flu shots, highly approved for people of different ages. Well, there are flu shots that are approved for use in people as young as 6 months of age and up, quadrivalent, remember that, spread in 2 doses, 4 weeks in apart, half of the dose today and the other half of the dose in 4 weeks. But let me tell you, the ones who are from England, and eat tea and toast. Let me switch my accent. You will have to receive the full vaccination dose instead of 0.5 milligrams per deciliter. So you will have to receive the whole milliliter in 4 weeks in apart. Remember, tea and toast. Okay. Come on, I love my southern accent. I'm talking about my southern accent because I'm from South America. That's why I'm talking about southern accent. Hey, did you capture? You all? All right. Hey, Carrie was the one who taught me about how to pronounce that. Can you remember that? If you want to be from here, you have to say, y'all. Good. Did I pronounce it well? No. Did I pass the test? No. No? Okay. No. All right. He's still in the process of recovery, my friends. He's not thinking well yet. All right. Okay, kids. All right, people who should take to their doctor before getting the flu shot. All right, my friends, children younger than 6 months are too young to get a flu shot. Please don't even think about it. It's a no-no. Remember what I mentioned to you at the beginning of the presentation. So you have to take them in apart from a person you suspect is already contaminated or is transmitting the disease. Please don't do it. And if the mother is still feeding the baby, milking the baby, even better. So people with severe, life-threatening allergies to flu vaccine or any other ingredient in the vaccine. When I'm talking about any other, some people are highly allergic to chemicals that are inside of the fluid that composes the vaccine, like antibiotics or simply certain substances. So, and when I'm talking about certain substances, I'm talking about what kind of substances? I'm talking about gelatin, I'm talking about antibiotic, and some other ingredients that I can talk here for hours and hours and hours, and we will begin to fall asleep. All right. I'm insisting. Special considerations regarding egg allergy. Remember, they have changed for the period 2016-2017. Remember, people with egg allergies can receive any licensed, recommended, age-appropriate influenza vaccine and no longer to be highly monitored for 30 minutes after receiving the vaccine, like years before, when these patients were taken to the hospitals under a medical doctor surveillance. Well, People who have severe egg allergies should be vaccinated in a medical setting and be supervised by a healthcare provider, anyone who is or should be able to recognize and manage severe allergic conditions. Totally different from years before. Years before, we have that very important amount of knowledge about the reaction. So every single patient who used to describe, I'm allergic to egg, okay, go to the hospital. So now the things have changed. Well, but what happens if we have a patient who already has the disease? So can we treat the patient? Absolutely. I'm sure that all of you are familiar with this medicine, Tamiflu. And it's commonly seen whenever you turn the TV and you want to see any Disneyland program or Disney program, so you see Tamiflu for, okay, sounds crazy, isn't it? Or you are in the middle of an excellent film and then Tamiflu for you to prevent it. Okay, whatever. Okay, my friends, be careful with this. Take Tamiflu within 48 hours of the flu symptom. Hey kids, whenever you have a patient in between the 48 hours with severe, as Dr. Lombo and Dr. Pardo and Dr. Boyce mentioned before, high fever, maybe sneezing, a lot of headache, a lot of muscle pains all over the body. So, and you suspect, and you take the patient to the hospital, and you have at least the rapid test. The rapid test, remember, is highly sensitive, but it's not highly specific. But if I'm your patient and I have all those symptoms, please prescribe me Tamiflu if I'm in the first 48 hours of the beginning of the symptoms. Reason why? I will shorten the whole period, the whole disease. I will shorten the disease, like, believe it or not, more or less 5 to 8 days. So please don't forget about it. After the 48 hours, no, just treat the symptoms of the patient and the signs of the patient. So it won't work. You will be losing your money, and it's very expensive, let me tell you. But if you have already been exposed, I'm insisting, but you don't have any symptoms, hey, my friends, if you don't have any symptoms, you can take Tamiflu for up to 6 weeks. I mean prevention, I will be talking about that, in order for you to prevent the disease. Well, but let's go to more specific information. Hey kids, adults and teens in between 13 and older. Hey kids, 75 milligrams twice daily, the ones who are in the nursing program and you are taking pharmacology. So please remember this dose, 75 milligrams twice daily for 5 days. Children 2 years and over, up to 12 years, 1 dose, based always on the weight, twice daily for 5 days. Tamiflu can be given to the patient either in capsules or liquid. Remember that children are not, come on, they don't like to take capsules. Reason why? Who can tell me why? Excuse me? And what happens? Excuse me? Okay, and who can give me a more specific thing? And you have to perform certain maneuvers for you to say, yes?
They're scared. Sure, they're scared.
In addition to, yes.
Yeah.
But there's a reason why.
It tastes better.
Huh? Sorry?
A pill, like if you dissolve in your mouth, it tastes better.
Okay, no, remember that capsule can go instead through the pharynx and to the esophagus, can go where? Bronchus. Is that clear? All right, that's good. All right, kids, but how the Tamiflu works? Can you remember the neuraminidase and the hemagglutinin? Who can tell me what is the function of hemagglutinin, as Dr. Boyce mentioned before? Who can remember that? Hemagglutinin, what is that for? What that protein is for? Dr. Dobson? Absolutely. Yes, you passed the test. You got A. All right. So remember, hemagglutinin is the protein that will allow the virus to be attached to the surface. And neuraminidase is the one that will facilitate, Dr. Boyce, the penetration to the cell and multiplication of the virus inside of the cell.
A.
So, yeah.
A.
Yeah.
She has A as well.
100. Any question with regard to this? No? May I continue? Are you sure? Are you starving?
Yes.
Me too. All right. hey, my friends, but we use Tamiflu for us to treat the patient, but we can also use Tamiflu to prevent the infection. Do you agree with me? Yes or no? Yes, you, sir. What's your name? Justin. Don't get afraid. I won't ask you to sing. All right? Yes, we can prevent. Remember, for adults and teens aged 13 years and older, how can we prevent? 1 dose, once daily for 10 days, or as long as your doctor or your nurse recommends. So, 1 dose, 75 milligrams, or 12.5 milliliters for adults and teens weighing 88.1 pounds or 40.1 kilos or more. Remember, now in hospitals, we are working more in kilos than in pounds. Children from 1 to 12, 1 dose, always based on the weight. And always, my friends, remember that the most important thing is the recommendation of your nurse or the recommendation given by the doctor. Remember that. So we can play a little bit with the doses according to what? According to the physical and phenotypical characteristics of the patient. I'm going to emphasize on something right now, is that Tamiflu is not approved yet for prevention in children at under 1 year of age. Please don't forget about that. All right, my friends, this is the end of this. I'm sure that all of you will hear, you have heard a lot of misunderstandings, and I will emphasize on the most important ones, okay, for the end of this presentation. The first one is, you will have too many patients that will tell you, hey, I had the vaccine last year, why to do it again? Who has the answer? Yes, sir.
Because the strain changes.
Absolutely. What is the name of that? Mutation. Perfect. So mutation. So you have to explain to your patient, hey, my friend, yes, but the same strain you had this season is not the same one, the one you had last year. The second is very expensive. What should be the answer? What is more expensive? To buy 20 medicines for you to feel better, or to invest, I don't know how much it costs, maybe $120, $150. If you don't have the insurance, that will be zero charge, instead of paying like 300, 400 medicines and prevent the complications of the disease, which is the worst thing. Well, the third misunderstanding is, I received the vaccine and had the flu anyway. I mentioned that. Who can remember that?
You got it.
Excuse me?
You got it too late.
Louder.
You got it too late.
I can't hear you.
You got it too late.
Louder. Oh, you see it? He doesn't have the flu. All right. Yes, I agree with you. He already had the virus inside, and the neuraminidase allow the virus to be inside of the cells. All right? Hey, I will wait until the symptoms and then, do you think this is correct? No. No, why not? Well, what happens after you have the symptoms? Remember the face of Dr. Pardo. All right. The other one is this one. The flu shot gave me the flu. So, is that correct? No. Well, I never get the flu, so I don't need it. Hey, it's like me. I'm a macho man, Latino macho man. So I don't need it. I never get sick. Am I correct? No. So I can suffer. Or, remember, I can transmit it. I can transmit it. Remember, 30% of the patients already affected by the flu are asymptomatic, but they are transmitting the disease, either to the baby, either to you, either to your grandmother or your grandfather. And remember, the highest level of complications will be in elderly and very young people. Well, the flu is not that bad. Do you agree with me? Can you remember the graphic, the differentiation between one to the other? Can you remember that? So whenever you have high fever, whenever you feel like, well, that's not good. I'm not at risk for flu. This is a repetition of the same. Hey, the vaccine is worse than the disease. Have you received the vaccine already? And did you feel any discomfort after the vaccination? Yes, a little bit of soreness on the arm. That's why the nurse will ask you, hey, which one of the two arms? So, and you answer the leg. All right, so why she asked you about which arm? Because you will feel a little bit of discomfort on the arm. Okay, that's it. And sometimes, rare cases, a little bit of elevation of the temperature during the first 24 hours, but not because you got the flu. Well, these are our resources. I want to say thank you to all of you. And that's all, folks. Thank you.